We'll be starting in 2 minutes. Let others join too, and then we can begin. Okay, so it's 5:05. I think we should start. Okay, good evening, doctor, and also hello, everyone. I welcome you all on behalf of Aashna Cares. Aashna Cares is a non-profit organization established on September 6, 2020, with the mission of combating poverty, promoting education, health, youth development, and also raising social awareness. We are working to create a supportive environment where people can come and help those who are less fortunate. It is so great to have you all here. First, I would like to introduce our speaker, Dr. Samrudhi Bhanushali. She is M.B.B.S. MD, currently working in the TATA Hospital Cancer Institute, Mumbai, in the Department of Anesthesia, Pain and Critical Care. She did her M.B.B.S. from Moscow and MD from Mumbai. She has also worked at AIMS Delhi and Rajiv Gandhi Cancer Institute. Actually, the main reason behind organizing this live webinar is that we get so many questions in our head regarding the vaccines, different COVID symptoms, etc. And there are so many resources with different facts. So we thought that in this need of hour, we need someone to clear our doubts regarding all these facts and what exactly we have to believe. And so I would like to thank Dr. Samrudhi Bhanushali to be with us here and give us her precious time. I would also like to tell our viewers, if they have any doubt regarding anything, they can write it in the comment section and we'll address it during the session or in the end of the session. Doctor, would you like to say something?
Yeah, thank you for such great introduction. Thank you, Rajeshwari. It's a pleasure giving this speech in front of you guys. Whatever you're comfortable in, English, Hindi, so we'll have a mix of everything. And we'll try to sort it out as many as questions as possible because right now the situation is really grave and everyone is going through very difficult times. Either your friends are admitted or your people who are your family, everyone is, it's a chaotic place outside. But we'll try to sort it out as many as possible questions, जिसको जो भी doubts है हम clear करेंगे और we'll proceed accordingly. Yeah?
Yes, I would like to say our viewers that we are going through a comment section. आपको जो भी doubt हो, if you want us to switch to Hindi या English, we'll do accordingly. So it is comfortable for everyone. So just feel free to share your doubts in the comment section. We are going through it. So if everyone's ready, shall we start with the first question?
I think before starting with the question, Rajeshwari, I would like to give a brief introduction to what is COVID, how it enters your body, and what are the phases of that. और उसके ऊपर से we can accordingly decide कि how should we go about it, and we can take questions after that. What do you feel?
Yeah, sure. It would be great.
Great, right? Okay. So whoever is watching this, so COVID, as you know, it's a really grave situation right now in everywhere. It's a pandemic. Pandemic मतलब हर जगह पे इसका problem हो रहा है. So what happens is it's a virus which enters your body and it enters through your nose. It's a droplet infection basically. जो एयर में नहीं होता, इट्स अ ड्रॉपलेट इन्फेक्शन. अगर एक रूम में सारे लोग हैं और कोई खांस रहा है, and then the droplets spread, and when you get in contact with the droplets, you get the infection. So that is how the spread is. So first of all, it goes to your upper respiratory tract, which is called as from your nose. इधर तक जो भी होता है part, that is your upper respiratory tract. So it affects that area. So this is the first step. So it is divided into 3 phases. तो first phase जो होता है वो viral overload बोलते हैं हमको. जो first phase होता है जिसमें virus multiply करता है. So it affects your upper throat. जब भी हमको sore throat होता है या फिर body ache होता है, fever होता है, that is all mild symptoms. So this is the first phase. Then there is a second phase which happens, which is goes to your lungs. So अभी तक तो ऊपर था, अभी वो नीचे चला गया towards your lungs, right? So when it enters your lungs, it affects your lung का alveoli. So जो छोटे छोटे जो particles होते हैं हमारे lungs में, start affecting that. So there are 2 phases in that. When it starts affecting your lung, it's called pneumonia. So जब lungs affect होते हैं, so जब lungs affect होते हैं तभी ये moderate severity में आता है. And इसमें भी 2 varieties होते हैं. One is oxygen dependent, जिसमें oxygen की जरूरत होती है, और एक में है oxygen, we don't need oxygen for that, even if it's pneumonia. It can be curable at home or else in institute nearby you with mild resources. And the third stage, which is very severe, which people are dying right now, is the severe phase. When what happens is, because of the continuous inflammation which is happening, inflammation मतलब continuous झगड़ा हो रहा है बॉडी के अंदर, बिकॉज कोई वायरस आया है अंदर, तो झगड़े की वजह से जो अल्वियोला होता है, जो लंग्स के टिश्यू होते हैं, वो पानी के ऊपर से भर जाते हैं, लाइक द वाटर इज फिल्ड इनसाइड इट, एंड द पेशेंट गेट्स ब्रेथलेस, कि उनको सांस लेने में ही प्रॉब्लम होता है. दैट इज व्हेन वी से द पेशेंट इज सीवियर. सो दैट इज हाउ यू कैटेगराइज इट. सो व्हेन इट इज माइल्ड, यू कैन टेक होम आइसोलेशन प्रिकॉशन, मतलब आप घर पे ट्रीटमेंट ले सकते हो. विल टॉक अबाउट इट लेटर, अबाउट एवरीथिंग. विल टॉक अबाउट डिप्रेशन, विल टॉक अबाउट द डाइट, विल ऑल्सो टॉक अबाउट द एक्सरसाइजेस. सो इट विल इवेंचुअली कम जैसे हम आगे बढ़ेंगे सेशन की तरफ. बट दिस इज अ ब्रीफ इंट्रोडक्शन दैट हाउ इट गोज इनसाइड योर लंग्स एंड हाउ इट अफेक्ट्स इट.
Ma'am, as you told us कि like किसी में mild symptoms होता है, किसी में ज़्यादा. So I just want you to tell me कि what exactly is the difference between a symptomatic and asymptomatic? Like क्या exactly क्या difference हो जाता है उसमें? So that would also help कि क्या exact.
Right.
We always hear that terms, right? कि कोई asymptomatic है, कोई symptomatic है. So what exactly is that?
Yeah, a good question, right? Like lot of people don't know about this. So asymptomatic patients, means like not. So there is no symptoms to that patient, but still he is positive. इसका मतलब क्या होता है कि he is able to spread it to other people. उसको ना ही फीवर होगा, ना ही बॉडी एक होगा, ना ही लॉस ऑफ स्मेल और टेस्ट, ये कुछ भी नहीं होने वाला है. बट ही इज अ कैरियर. कैरियर मतलब उसके अंदर वायरस है, and he can spread it to the people because his immunity is good. It's not affecting him. इसीलिए उसको symptoms नहीं आ रहे वो पर्सन को. Whereas if I'm sitting with a person who is unaffected by it, but his immunity is low, for example, cancer patients, अगर मैं उनके साथ हूँ, पर उनको अगर मैं I have the ability to this one transfer it to the other person, like जिसकी immunity कम है, तो I being an asymptomatic person, I am a carrier. मतलब मैं दे सकती हूँ दूसरों को. That is asymptomatic. Whereas symptomatics is anything which is loss of smell and taste, or else you get weakness, headache. Nowadays there is diarrhea also, which is there, so you should be very cautious in the second wave. Diarrhea is also one of the symptoms jahan people just get diarrhea and they are positive. So these all comprise of the symptomatic people, and this is asymptomatic where you don't show symptom but they are carrier and they spread it to other people.
Ma'am, is it possible that if a person is asymptomatic starting में, like initially when he is testing, he is feeling कि मुझे कोई symptoms नहीं है, but maybe later he can turn symptomatic या नहीं, he will just stay asymptomatic for the next 14 days?
Yeah, so definitely that can happen. Like starting में उसको कोई symptoms नहीं. So there is a one thing. Why do we say that there should be a 14 days isolation? So it comes back to that. So 14 days isolation जब हम बोलते हैं, that is the patient has been exposed to the virus, और वो virus replicate हो रहा है, मतलब multiply हो रहा है in thousands and millions of copies. So when the इतना amount of viral load बढ़ जाता है, that is how you show the symptoms, or the person shows the symptoms. तो अगर उसका viral load बहुत ज़्यादा हो गया during this incubation period of 14 days, that is how he will show symptoms. तो symptomatic भी हो सकता है वो patient who is asymptomatic basically.
Yeah. Okay. So, like, so normally, abhi, so recently we hear a lot about plasma donations. So there's one question that we always come up, like, can you elaborate on the need to donate plasma during such times, and who exactly can donate it?
Okay. So plasma donation is not evidence based anywhere कि इससे फायदा होता है, but it has shown improvement in lot of people. Because COVID के लिए कोई treatment नहीं है. Frankly speaking, there is no treatment for COVID. We are only controlling the symptoms. We are only decreasing the viral load. That is the aim. That is what we are doing. So if in order to reduce the viral load, so we are giving plasma to this patient. तो ये plasma क्या होता है? हमारे body में ब्लड जो होता है ना, ब्लड दो कंपार्टमेंट्स में बनता है. एक तो वाटरी जो होता है वो, और आपके आरबीसीज होते हैं, लाइक द रेड ब्लड सेल्स, जिससे हम लोग को कलर आ जाता है. जो रेड कलर हीमोग्लोबिन जो होता है उससे आता है. तो वी टेक आउट द वाटर लेवल. सो वाटर जो प्लाज्मा होता है वो हम निकालते हैं, एंड दैट इज हाउ उसमें जो पेशेंट अगर कोई पॉजिटिव रहा हो उसमें एंटीबॉडी प्रोडक्शन होता है. सो दैट इज हाउ द एंटीबॉडी प्रोड्यूस इज हेल्पफुल इन द पेशेंट हु हैज बीन सफरिंग फ्रॉम कोविड. सो जब हम प्लाज्मा देते हैं एक पर्सन को, एंड नाउ दैट अभी पेशेंट ऐसा हो रहा है कि आई थिंक फ्रॉम 1st of May above 18 people are supposed to get vaccinated. So there is a timeline, like if you take vaccine after 28 days you can donate plasma. Before that you can't donate plasma. So a lot of people will be donating, what of the youth will be going for the vaccine, and we'll have shortage of plasma. So in order to combat that, what we can do is before taking vaccine one can donate plasma, irrespective of either agar plasma bhi, agar if you're even negative you can donate blood. So it is going to be helpful in one or the other way, and you can help in like little steps, or you can do some from your own side. So the question arises here, who can donate plasma and who can not donate plasma? So people who are above 18 years of age can donate plasma. One who is above 55 kg. Also a person who has any mild diseases can donate plasma. पर ये बहुत misconception हो रहा है कि diabetic patient can't give plasma, which is not true. If his sugars are under control, if he is not on insulin, he can donate plasma. The person can donate plasma. Also, the hemoglobin should be more than 12.5. So see, these are the criteria where you can give plasma. Such people can give plasma, and provided your RT-PCR should be positive in your recent times when you were positive. So मतलब आपको infection होना है, इन्फेक्शन के बाद आपको क्योर होना है, उससे एंटीबॉडीज प्रोडक्शन होता है, एंड दैट इज हाउ यू कैन गिव प्लाज्मा. द मोस्ट इंपॉर्टेंट कैटेगरी हु कैन नॉट गिव प्लाज्मा, बिकॉज ये सबसे इंपॉर्टेंट कैटेगरी की कौन नहीं दे सकता है प्लाज्मा. सो दे आर प्रेग्नेंट वुमेन्स. लाइफ में कभी भी प्रेगनेंसी रही हो, आई हैव ऑल्सो स्पोकन ऑन माई इंस्टाग्राम पेज अबाउट दिस, कि अगर लाइफ में कभी कोई भी इंसान प्रेग्नेंट रहा हो, द फीमेल कैन नॉट डोनेट प्लाज्मा. अ पर्सन हु वॉज अ कैंसर सर्वाइवर also on the treatment of cancer cannot give plasma. Also a person who had liver disease, heart disease, ये plasma नहीं दे सकते हैं. So why is that कि pregnant? Okay, so even that question arises, like why?
Like what is the specific reason कि pregnant women क्यों नहीं दे सकते plasma? Is there any specific reason for that या बस?
Yeah, so there is obviously reason to everything we do. So there is science behind it. So whenever baby is born, so it's a combination of maternal and paternal genome, right? So जब baby born होता है, it's a antigen, मतलब वो बाहर का कोई तो product है, like a father's जो आता है, it is a बाहर का thing, genomic, which is introduced, and after that the body starts reacting to it. So the maternal components जो होता है उस पे attack होना शुरू हो जाता है. So to avoid that, when you give plasma to a person who is pregnant, like who has antibodies also. So if you give it to the other person, it can lead to a serious lung disease. So हम वो avoid करते हैं because of the paternal component included in it. So it is थोड़ा सा more science, but yeah, that is the reason.
So we have a question in comment section. Is plasma effective?
Yeah.
Like आपके नजर में ऐसा examples where plasma बहुत effective हुआ है actually?
Yeah, मेरे नजर में हुआ है. Working in the COVID institute, I have seen lot of patients. It's an example from my own house. My grandmother suffered from COVID. We gave her remdesivir, we gave her everything, but we thought that she couldn't make it. But finally, we asked for plasma everywhere, and that is how we donated her. And right now she's at home, which is a very good thing. Provided she requires oxygen at home, she is doing her exercises. Exercise जो भी हो रहा है वो कर रही है, so she is better off now. But yes, and I have seen it personally at my own house happening. Like it was a miracle that she came out as a warrior, or she won the battle. She is 80 years old. So that is the thing. So there are no evidences anywhere, but I have seen myself. So I would obviously recommend you to guys to whatever it is, because I know how difficult it is to get plasma when we were begging for our grandmother. Literally, we had to ask every person, like, can you give? But one person who, his name is Rohit, I should mention, and Shweta, who's my friend, who this one told me to ask him about the plasma. He came up in front. He traveled from Dombivli to Thane just to give plasma.
That's great, isn't it? Like,
that's great.
Explain that. From on behalf of Aashna Cares too, we'd like to thank them that they came forward. Like, so there's so much of myth ki, I don't know why people are stopping themselves from donating plasma, right? I think that there should be this awareness ki plasma देने से कुछ problem तो नहीं होने वाला. You are just helping someone, right? And it is useful, तो I think सब लोगों को donate करना चाहिए before getting vaccinated, as you have mentioned already.
Yeah, definitely you should.
And also the next question that we get is there has been a lot of misinformation spreading on internet that talks about vaccination having major side effects on pregnant women, or that it would cause infertility. So can you tell our viewers why they shouldn't worry and get themselves vaccinated?
This is so not true. First of all, stop believing everything, whatever is there on social media. First of all, that is the first rule, because WhatsApp messages, they disturb you. They are not true at times. People just want to scare other people. It is not like there are not good people around. ऐसे नहीं है कि सब बुरे लोग हैं, but कोई लोग होते हैं to maintain the balance. There are bad people also, so they spread such rumors. But ऐसा कुछ भी नहीं है. Everyone should get vaccinated, and that is how, मतलब सबको ही लेना ही है. ऐसे कुछ भी नहीं है कि उसे इनफर्टिलिटी हो रही है या पीरियड्स में नहीं लेना है. दैट इज नेक्स्ट रूमर विच वाज स्प्रेड कि पीरियड्स में अलाउड नहीं है, और ये सब होक्स है. ये कुछ भी राइट नहीं है, ये सब झूठ है. यू कैन टेक वैक्सीन, एंड इट इज इम्पोर्टेंट टू टेक वैक्सीन. इवन हाई रिस्क पेशेंट्स एंड एवरीवन शुड बी वैक्सीनेटेड. Only the thing is, the pregnant females should go for Covishield instead of Covaxin. So there are two variants in vaccine. One is Covishield.
So what is exactly is the reason, like why Covishield and not Covaxin?
It has their institute itself. So there are like two major branches which are giving vaccines. So we should be really proud that we have given so many vaccines outside also, and India is producing a vaccine, which is a really proud moment for our country actually. So जो भी बोल रहे हैं ना कि वैक्सीन से कुछ नहीं होता, वैक्सीन हम नहीं लेंगे, वो गधे हैं फर्स्ट ऑफ ऑल. बिकॉज इतना रिसर्च करके किसी ने कुछ ढूंढा है. दे हैव पुट इन देयर डे एंड नाइट इन दैट, एंड वी हैव emerged as a country who is donating vaccines. So you can understand the gravity of the situation कि कितना important है vaccination. So there are two vaccines. One is Covishield and one is Covaxin. जो Covaxin है वो भारत की तरफ से हो रहा है, whereas the Covishield is from Serum Institute India. So they themselves have criteria, मतलब उन्होंने क्या बोलते हैं, they have told themselves like whoever should take it and whoever should not take it. So among them, they don't advise pregnant females or the patient who is on blood thinners, जिसको हार्ट अटैक आके गया हो और ब्लड थिनर्स पे हो, या फिर कोई इम्यूनोकॉम्प्रोमाइज्ड पेशेंट है, वीकनेस आ रहा है किसको, तो they can't take vaccine. It comes in Covaxin, whereas Covishield can be taken from everyone. Everyone can take Covishield.
Is there anything like ये ज़्यादा effective है and ये नहीं है? Is it anything like that? या नहीं, दोनों both are like, they both have their own advantages?
Okay, so both are equally effective efficacy-wise. It's according to the research and the papers which had published, Covaxin is said to be a bit better, but still ऐसा कुछ भी नहीं है. It is like 5% का आगे पीछे है. Both are equally good in their own way. Even Covaxin, even Covishield. Nothing else, that's all. सिर्फ Covaxin का ये ऐसा बोल रहे हैं because nowadays जो वायरस आ रहे हैं म्यूटेट हो रहे हैं. म्यूटेट मतलब उन लोग अपना रूप चेंज करके आ रहे हैं. Like they are evolving, right? So उन लोग अपना रूप चेंज करके आ रहे हैं. That's why they are mutating. So in that mutant cases, Covaxin have shown to give better results. इसका मतलब ये नहीं है कि Covishield is not showing better result. It is not true. So both are equally effective. Provided you're getting the vaccine, just get it done.
In some article it was mentioned that vaccine is like for 617 newtons ही उससे वो protect करता है. Like I've read some article, so maybe इसलिए people are arguing on that कि maybe co-vaccine is better than Covishield. But I think that but जब vaccination centers जा रहे हैं तो I think that like 18 के above आप क्या suggest करोगे that we shouldn't do anything like this कि हमको वही चाहिए and वो नहीं.
No, please don't do that. No, don't do that कि मुझे यही चाहिए, मुझे अभी वही चाहिए, वो सब. It is not a choice. You are not getting any choices that you have to choose one among them. Whatever it is, everything is effective in their own way. Mutation जैसे देखेंगे तो there are 50,000 mutation which has happened. So and 600 mutations को protect करा. What about the rest of the mutation? So it is completely not logical to give such reasons and not take vaccine. I feel. ऐसा कुछ भी नहीं है तो anything is fine. Basic thing ही हमको लेना है. That is only the main agenda of us taking the vaccine.
Ma'am, after taking the vaccination, it is suggested by most of them that we should take paracetamol. So, is it true or we should avoid it? What do you think?
No, what I feel personally is you should take paracetamol, not any NSAID. NSAID is a combination of drugs. वो नहीं लेना है. Any painkillers should not be taken because it reduces the efficacy of the vaccine. So what you can do is you can take the paracetamol 650 mg around. You can give depending upon the weight of the patient. So you can give it thrice a day, whatever it is, however it is, you can give. Regarding the vaccination, when you take the vaccine, basically, तभी आपको लेना है after half an hour, so you protected from the inflammatory reaction which happens. So take it after half an hour, and then you can repeat after 8 to 12 hours, whatever it is, whatever suits you.
Ma'am, we have also read somewhere that people who are obese or are overweight, उनको कुछ problems होता है vaccination से. So is there anything that extra care that they should take before and after vaccination?
Yeah, so तो ऐसा है कि vaccination से सबको ही थोड़ा बहुत problem होता ही है because that is a protective response which is happening, right? So obese patient because they have low FRC कहे तो उनका lung का जो volume होता है usually कम होता है. They are fat, so when they sleep उनका जो डायफ्राम होता है जो हमारा जो डिवाइड करता है थोरैक्स एंड एब्डोमेन को ऊपर चला जाता है. उसके वजह से उनकी लंग की जो कैपेसिटी कम हो जाती है. So in such patients, obese patients, they should definitely take vaccine. That's what first thing is. And उनके लिए कुछ ऐसा precaution नहीं है कि ये करना है वो करना है. That is nothing of that sort. ऐसा कोई there is no recommendation as such.
Ma'am, we have one question in the comment section that we see a person gets positive reports of COVID even after second dose of vaccine. Why is this?
Yeah, so क्योंकि as said कि vaccination is not 100% protection. It is just that it decreases the severity of the disease. बहुत टाइम में ऐसे भी हो रहा है कि I have seen patients who are positive but their RT-PCR is negative. So it's on clinical basis also कि clinically if you feel that you have such symptoms right now, anything, any sore throat, any cough, any fever is COVID. Right now, that is the situation. So अगर आपको लग रहा है कि आपको ये सारा है तो you take precautions and treat as you have COVID. आपको COVID है, start wearing mask, start isolating yourself, start getting quarantine at your own place, start seeing your oxygen levels and everything.
Yeah, so regarding the oxygen levels, I had one question. Like, if someone is asymptomatic, so doctors suggest them that they should keep checking their oxygen saturation. So how regularly should this checking be done in such cases? And what percent of oxygen saturation is a sign of worry?
Okay. So first of all, talking about oxygenation, how the blood gets oxygenated. So when we breathe in the air, right? तो जब हम air breathe करते हैं उसमें oxygen होता है, सब elements होते हैं, बाकी सब gases भी होते हैं. तो when you breathe inside, वो हमारे lungs तक जाता है. That oxygen is gone to the vessels, blood vessels, and वो blood vessels hemoglobin जो हमारा होता है उसके जाके attach होते हैं. And that is how when you check the oxygen level, जब saturation check करते हैं तो it shows the blood oxygen level. So usually it is normally 98 to 100% normal people में. Nowadays, so we have according to AIMS guidelines, so we have categorized this oxygen according to it should be till at least 94%. 94% के ऊपर होना है अगर patient COVID positive है तो, and you can monitor this oxygen levels every, like in a day, thrice a day you can monitor the oxygen level. So if it's less than 94%, that's a worrisome, so it comes under moderate risk. So 94 के नीचे गया है और 90 के ऊपर है, मतलब वो moderate risk में आ रहा है, the person will need oxygen. You should start searching for hospitals or start searching for the setup where oxygen is required. And if it's less than 90, patient might require ICU. So I can just demonstrate it once. So this is our pulse oximeter, right? So this is a pulse oximeter. And आपके nails पे nail paint नहीं होनी चाहिए. And because it ऐसे नहीं है कि it shows the wrong result, but fluctuation हो जाता है फिर results में. Also your extremity should be a bit warm. एकदम ठंडा cold extremities नहीं होना चाहिए, or else the patient shouldn't continuously shiver. Shivering में it shows wrong oxygenation. And also you can't do the oxygenation keeping up your hand like this. It should be at the heart level, okay, or else just below it. And then you attach the oximeter here. So I've attached the oximeter here, okay, and this is a white button which I press. And then you wait for 30 seconds to show the exact value. I don't know मेरा कितना आने वाला है, मैंने खुद नहीं देखा है. This is the first time I'm checking. Let's see. So yeah, so I think so we can check. Can you see?
Yes, I can see.
I think it's blurred. So this so this is the value, which is 98%, which is the SpO2, which is the saturation level, this one. So this tells about the oxygenation. So okay, I'm healthy baba, तो मैं ठीक हूँ अभी के लिए तो. So this is my saturation level. जो ये side में जो आता है, this one, this is your heart rate. So ideally it should be from 70 to 80, like 60 to 80 is normal heart rate. मेरा थोड़ा ज़्यादा बढ़ गया है शायद से, मैं वेबिनार दे रही हूँ उसकी वजह से शायद. I don't know.
Even when I check my oxygen most of the time, तो मुझे वो 100 range में आता है. So कुछ टेंशन का बात है क्या?
क्या sorry?
Like my pulse rate mostly जब भी I check for my oxygen level, so it comes around 100. तो कुछ टेंशन का बात है क्या वो?
कुछ टेंशन का बात नहीं है. Might be there's some anxiety, or you have just come walking and you're sitting. So that is a physiological thing. Or you have exercised and your heart rate has increased. That is a physiological thing. Also there's a pathological thing which can happen जब heart rate increase ज़्यादा होता है, where it should be worrisome, is one is fever. तो फीवर में हार्ट रेट बढ़ता है बिकॉज ऑक्सीजन ज़्यादा लगता है बॉडी को फीवर को कॉम्बैट करने के लिए. तो दैट इज व्हेन योर ऑक्सीजन दिस वन योर हार्ट रेट विल राइज. If you have some infection, that is the time your heart rate will rise. So there are some, if you have anemia, your heart rate will rise because anemia में hemoglobin कम हो जाता है, तो वो compensate करने के लिए हमारा heart और जोर से fastly beat करता है in order to catch up with the reduced hemoglobin. So that is when you can have, even in thyroid patients who have hyperthyroidism, thyroid ज़्यादा है जिनका, उनमें भी heart rate ज़्यादा आ सकता है. So it depends कि what is the cause, why the heart rate has increased, but it's not a worrisome unless and until it's like extreme.
Yeah, okay. So we'll go with the next question. Actually, okay. So there we have seen a WhatsApp message where consuming more alkaline foods will help us to eliminate the virus, and the source was Tata Digital Health. So can you verify if it's true or false?
Yeah. So not just COVID, but in generally, if you consume alkaline food, it's very beneficial for the body. It's been proven in the theories. It's a lot of papers, a lot of research have been done, and it has been shown कि जो alkaline food खाते हैं, उनमें cancer का जो प्रमाण होता है, or else liver diseases, heart diseases के chances बहुत कम हो जाते हैं. So there are a lot of fruits. So there are acidic foods, there is alkaline food, and there is neutral food. So acidic foods में आता है हमारा meat, eggs, fish, ये सारे जो आते हैं ये हमारे acidic food में आते हैं. Whereas alkaline में all our veggies come, soybean come, all the nuts and seeds and all that, they come under your alkaline food. So these will help you in, because our body already has a lot of acid in us. Our stomach का pH मतलब acidic, बहुत acidic होता है हमारा. तो वो न्यूट्रलाइज करने के लिए we have to have the alkaline food which you should consume, which is very good for your health. इसीलिए जब भी बोलते हैं कि सो कार्बन डाइऑक्साइड जब हम ब्रीथ करते हैं वी टेक इन ऑक्सीजन एंड वी रिलीज कार्बन डाइऑक्साइड. तो जो कार्बन डाइऑक्साइड होता है इट बेसिकली कॉजेस एसिडोसिस इन योर बॉडी. एसिड प्रोडक्शन में हेल्प करता है, इसीलिए वो बाहर जाना बहुत इंपॉर्टेंट होता है. तो क्यों हम जब बोलते हैं कि जस्ट टेक डीप ब्रेथ्स, so when you take a deep breath you put in more oxygen in and you give out all the carbon dioxide outside, so you're giving that acidic product outside your body and you're taking more of the oxygen inside. So that is how it helps.
So it means it helps somewhere, right? So we should consume alkaline food.
More alkaline food, not just in COVID, but in everyday life, it really helps. It is good to have alkaline food in your. Even vitamin C, like when we say about lemon or oranges, we say it's acidic fruit, but it's acid if it's outside, but when it goes inside your body, it metabolizes. जब वो टूटता है छोटे-छोटे parts में, तब वो alkaline हो जाता है. That's why we say consume lot of vitamin C containing food. That is the reason.
Do you want to give suggestions to people who are like going for the vaccination, like people above 18? So is there some kind of food that they should consume before going to the vaccination and after the vaccination? Is there some guidelines for that? Or
no, there is no such guidelines. जो भी खाने का मन करे सब खाओ, कोई problem नहीं है. Just fried, spicy जो food हम हमेशा avoid करते हैं because it causes more acidity, right? जो ज़्यादा heavy food होता है, जो spicy food होता है, especially Indian food is spicy only. But whatever it is, so you can eat anything. There is no guidelines for that कि हमको यही food खाना है, इसके वजह से हमारा vaccination का process will be easy. Try not to take alcohol because efficacy कम हो जाती है. At least a day you can just skip your alcohol, smoking and all that for a day at least. And that is how there is no such guidelines कि यही खाना है और वही खाना है.
And how effective is one dose of vaccination as compared to two? Like एक डोज से भी कुछ like कुछ परसेंट कवर होता है या नहीं?
एक डोज से होता है, पर वो अभी तक साइंटिस्ट को भी नहीं पता कि हाउ इफेक्टिव इज दैट. सो we can't comment on that, but both the vaccines should be taken. And एक वैक्सीनेशन से यू कांट से कि कितना एंटीबॉडीज या फिर कितना इम्यूनिटी प्रोड्यूस होगा. So it's very important to take both the vaccines. Like it should be 28 days, 6 weeks apart, so 28 days apart, so whatever it is. After depends upon the Covaxin or Covishield, whatever you're taking. 6 weeks to 8 weeks में आप वो vaccination ले सकते हो, like second dose. But both the doses are important. There are a lot of studies, not studies also. My friends who are working in COVID, after taking first vaccination, they have come positive. Even second vaccine positive cause करता है, but it reduces the severity. So that is very important कि because severity अगर होगा तो it would be very dangerous for the patient.
Like Covishield, like the guidelines that came recently, we have to increase the gap of weeks. Like first it was 28 days, now it's something 42 days. So like if someone takes after 28 days, like उसका effectiveness कम हो जाता है या it's same? What do you say?
No, कुछ effectiveness कम नहीं हो रहा है, but लोग positive आ रहे हैं. तो they are giving थोड़ा time so that more of the vaccine gets effective in that period of time, and then you can take the second vaccine. ऐसा कुछ ये हार्ड एंड फास्ट रूल नहीं है कि 28 डेज तक अगर तुमने नहीं 28 डेज के पहले ही ले लिया तो दैट वुड क्रिएट मेजर प्रॉब्लम. ऐसा कुछ नहीं है. स्टार्टिंग में लोग 28 डेज के बाद ही ले रहे थे, बट बिकॉज ऑफ द स्टडीज, बिकॉज दे केम पॉजिटिव, so they have increased the two weeks gap.
Ma'am, we have a question in this comment section that if we are taking first dose of Covaxin and another dose of Covishield, is it okay or both of the dose should be same?
It should ideally be the same vaccine which you're taking. If you're taking first Covaxin, let it be Covaxin. If you're taking first Covishield, next Covishield. But I know कि news में क्या आ रहा है कि people are saying the second dose should be Covaxin, and ऐसे news में आ रहा है which I recently heard about and read about. It is ऐसा कुछ भी नहीं है. There is no better है कि अगर एक ही आप vaccine लो, which is more better. I think the production अगर कम हुआ है, that's why the government is like taking next co-vaccine. I don't know what is the reason, like they're saying all of a sudden, but better to go with the same vaccine which you take the first. अगर first आपने co-vaccine लिया हो, better you take co-vaccine as your second vaccine.
Ma'am, everyone after vaccination are getting different symptoms. Like some are getting fever, some have the pain in sore hands or pain near the neck. So, what is the reason of this? Different symptoms in different bodies. Is some specific reason for that?
So we all know that every body is different in some other way. Not every person has cancer. Not every patient is diabetic. The same way, the theory applies to the same. कोई जिनकी hyperactivity ज़्यादा होती है, the immunological response, जो immunity का response होता है, अगर उनमें ज़्यादा हो तो उनको ज़्यादा symptoms आते हैं, और जिनका इतना एक्टिव नहीं हो उनमें इतने हार्डली सिम्टोमेटिक नहीं दिखते हैं. और एल्स पीपल हु आर ऑन ड्रग्स, कोई स्टेरॉइड्स ले रहा हो या कोई दूसरे मेडिकेशंस पे ऑलरेडी हो, उनका रिस्पॉन्स ज़्यादा नहीं दिखा जाता. बट one and all, अगर symptoms आए भी तो it will resolve in a day or two. Nothing else that sort.
There's one question: can blood clots occur as side effects?
Blood clots, yeah. There are studies where blood clots हुए हैं लोगों को, and but the ratio is really low. बहुत कम लोगों को ऐसा हुआ है कि ब्लड क्लॉट्स हुए हैं. दैट्स व्हाई पीपल आर टेकिंग एस्पिरिन आल्सो 75 mg बिफोर गेटिंग वैक्सीन. अगर कुछ वैक्सीनेशन के लिए जा रहे हो, आफ्टर ओनली कंसल्टिंग योर डॉक्टर्स ऑब्वियसली. लॉट ऑफ फीमेल्स दे आस्क टू टेक 75 mg of aspirin and then go for vaccination a week prior. But it is not proven anywhere, or there are no guidelines for that. But yes, you can consult your doctor, which is very rare clots होना. But yes, studies ने report किया है कि there are chances that you get clots in your blood vessels.
Okay, there's also one question. Like, if a person is regularly doing exercises, so is it helping that person somewhere कि उसको COVID नहीं होगा? Is it something like that?
तो ये question, it is helping him somewhere, but COVID नहीं होगा is a wrong statement to pass, because your exercise is nothing to do with your COVID happening. If you're not following the regular norms, if you're even healthy, we have seen 34-year-old who was there, who was I think the bodybuilder who is very famous. वो तो कितना exercise करता होगा, उसके lungs कितने अच्छे होंगे. Lot of people who are doing yoga have succumbed to death. So it is not like कि अगर exercise कर रहे हो तो आपको COVID नहीं होने वाला. If you break the norms, if you don't wear mask, if you are exposed, तो वो होना ही है. वो सबको ही होना अगर if you don't do that. But yes, उनका severity अगर होगा तो बहुत कम लेवल पे होगा, because they are already doing yoga since so long, which are also talk about कि how to do yoga and मतलब what are the exercises which you can do after getting COVID, like post-COVID care, as we say. We can throw light on that after some questions or however it is.
So if a person is COVID positive, so after how many days is he or she ready to take vaccine?
Okay, if the COVID positive patient है, you can take your vaccination in 14 to 28 days. Mostly 28 days के बाद लेना है, और patient should be symptom free. ऐसे नहीं है कि भले आप नेगेटिव पर आपको थोड़ा वीकनेस है या फिर आपको थोड़ी खांसी है. Better avoid taking vaccination. 28 days के बाद you can take your vaccination. That is the ideal guidelines which have been following for the dose after getting positive.
So if a person is having weakness, so is it recommended that he or she should take vaccination in that period, or she should avoid?
Better you avoid it, because vaccination can wait for a while. ऐसा hard and fast rule नहीं है कि अभी ही लेना है आपको वैक्सीन, और नहीं तो it will be disastrous, और ऐसा कुछ भी नहीं है. First you get yourself treated and then only proceed further. कि मेरा weakness पहले कम हो जाए, then we can see कि क्या करना है.
Okay, so we have one question that after my home isolation period, I did RT-PCR again and it is still showing positive. So is it normal? And I have and do that person has to test again? If yes, then after how many days of home isolation?
Okay, so this is a very lot of people have been asking me this on Instagram also, Facebook also कि क्या है. So try to understand. So when you do RT-PCR, RT-PCR is a thing which even it detects your RNA. तो हमारा जो वायरस है उसमें RNA होता है, तो RNA को डिटेक्ट करता है. So even if there is a dead RNA virus, it will detect that. So ideally 14 days तक if you're symptom free after like there is no fever since 3 days or 14 days हो गए हैं, you need not even repeat an RT-PCR according to new guidelines. RT-PCR की कोई ज़रूरत नहीं है. It can still show positive till 3 months. 3 months तक एक पेशेंट पॉजिटिव आ सकता है. तो फिर वो और टेंशन क्रिएट करता है और प्रॉब्लम्स क्रिएट करता है कि यार मैं नेगेटिव ही नहीं आ रहा हूँ, एंड देन यू आइसोलेट योरसेल्फ एंड ऑल दैट. बेटर डोंट डू इट बिकॉज इट्स नॉट रिकमेंडेड एनी मोर कि आपको करना ही है. आपका 14 डेज का पीरियड हो गया है, यू आर सिम्टम फ्री, देन यू डिड नॉट रिपीट योर RT-PCR because your dead virus will be detected.
So there's one more. Okay, yeah. Why doctors these days are suggesting to use double mask? Like it's the most talked topic, like double mask. So how useful is it?
Ideally, you should be using an N95 because it will protect you because there is a good protection. Basically, the pores and all that is a lot of physics behind that, the pores and all. But N95 is using. अभी बोल रहे हैं कि second mask डालना है just for the protection sake. I feel because there is nothing of that sort. Because if there are less number of N95 or whatever it is, there is no such reason. Double masking is important because you can just remove your mask, get infected, then other mask you'll have your mask on. That is the reason. There is no such thing कि दो mask ही पहनना है. You can wear one mask also, but it should be a good mask. That's it.
Like I have read one article just me they were suggesting that you use a disposable mask and उसके ऊपर a cotton mask. So
Okay.
Is it helpful या नहीं? If one single mask good quality is also good.
Yeah, I feel one single quality is also good. You did not buy 2-3 masks ऊपर से पहनना है. Already you sneeze in that, you do everything. मतलब you rebreathe in that basically. आपका ही breath आप ले रहे हो. It is not causing any harm, but why to shell out so much money when one good mask can suffice everything? So I don't feel कि 2 mask ही पहनना है उससे ही protection आता है. I don't feel. We work in hospitals. We wear one N95 and we even see COVID patients. So it is ऐसा कुछ भी नहीं है कि double masking करना ही है. But it is better. Prevention is always better than cure, as we say. So we are just taking precautions. Nobody knows the science behind it. Everyone is trying to find out one or the other way कि ये हो सकता है, ये नहीं हो सकता है. So that is how it is.
Ma'am, also we come across this always that steaming actually helps for the reduction in the COVID this symptoms, and so can you put light on that? How exactly steaming helps us?
Yeah, sure. So what happens is nowadays what we have seen is so there are sinuses behind this. So when you see if you open the skull or whatever it is, so अगर आप पीछे देखोगे तो यहाँ हमारे sinuses होते हैं. So there is ethmoidal sinus, maxillary sinus, all these sinuses are there. So वो sinuses में जाके ये virus बैठ जाते हैं. So how are you going to protect those part? So that is when you take steam, and steam is really helpful. It's really helping people because virus doesn't stay in a hot environment. मतलब वो मर जाता है virus. So when you take steam, so you have to open your mouth and close your mouth and take it from your nose. So आप जो nose से लेते हो वो पूरे nose से through पीछे से जाता है, and it steams helps in destruction of that virus. So it goes to the sinuses also. So it has shown very beneficial effect in steaming. So you can take steam thrice a day. Every 4 to 6 hours you can take steam, which will really help you, everyone actually around. Steaming basically.
Ma'am, this question तो आपने हमेशा होगा. Like how long? So
hello, sorry, hello. I couldn't hear you.
Yeah, was I audible?
Yeah, you're audible. Yeah.
Yeah. So ये question तो आपको बहुत सुनने मिलता होगा that how long will COVID exist?
Oh God, I think भगवान के पास भी उनका आंसर नहीं है. I think nobody has the answer to it. But it's going to be a long run for every one of us. Everyone अभी 4 lakh cases है. There is going to be time where there will be 5 lakh cases. So next week में mid week से cases बढ़ने वाले हैं, which is proven, which has seen the data around all the other countries and the second wave. They are saying the third wave is also going to come. So we have to fight. हमारा battle बहुत long होने वाला है. So this is how we are going to help each other in this difficult times. I know there is no answer to this, like कब जाने वाला है, कब होने वाला है. Nobody knows it. Nobody can answer this.
Like even our viewers want to know exactly, everyone has this question in the mind, पर इसका आंसर actually किसी के पास भी नहीं है.
किसी के पास भी नहीं. मैं बोल रही हूँ ना, भगवान के पास भी नहीं होगा, because I don't know कि how long it's going to take, but another 2-3 years for sure कि ये होने ही वाला है, या फिर भी masks रहने ही वाले हैं, और it's going to continue for a while.
Okay,
not keeping you guys in dark, but this is the reality.
Okay, so next question that we got here is, any idea regarding the time antigen stays in the body?
Which antigen stays in your body? I'm not aware about this, like how long, because I've never read about it कि कब तक रहता है. There is no proven anything, or there are no articles regarding this कि कब तक रहता है. But it can stay for even, I don't know, if someone knows about it, aware about it, you can actually teach me, because I've never read about it कि कब तक रहता है. I've never read about it also, so I'm not aware.
This was the question in the comment section actually.
No, even I'm not aware. We'll search about it. Actually, it's a very good question. I will search about it, and I'll let Aashna Cares know about this, so that they post on the Instagram.
Yeah, sure, we'll do that.
Yeah.
With the credits of the person who has asked this question, actually.
Yeah. No, but it's a good question. Like even I don't know. We'll have to search about it.
And there's one question that if a person has fever for a day, and also loss of smell and taste for a week, does that mean that he or she is COVID positive?
Yes. Yes, right now, any loss of taste or smell with 1 day of fever, with no day of fever, it's COVID positive. ये पकड़ के ही चलना है कि आप कोविड पॉजिटिव हो. इसका मतलब ये नहीं कि वी हैव टू पैनिक एंड यार क्या होने वाला है, हाउ विल आई सर्वाइव दिस. इट्स नॉट लाइक दैट. इट्स अ माइल्ड. If it's treated early, it can be treated well. Everybody responds in a very different manner. So इसमें I want to throw some light कि कब symptoms आते हैं, when it's the incubation period. तो अगर आपको आज symptom आ रहा है, so it's a day 0, समझो आज मुझे fever हो गया है. इसका मतलब ऐसा नहीं है कि आज मुझे एक्सपोज हुआ है. इसका मतलब है कि 10 days से मेरे को एक्सपोजर चालू है. सो 3 days माइनस करके आप पीछे जाइए, तो तब से मेरा एक्सपोजर चालू ही है, इसीलिए मुझे आज सिम्टम्स आ रहे हैं. सो day 5 इज वेरी इंपॉर्टेंट इन कोविड, बिकॉज दैट इज व्हेन योर इन्फ्लेमेटरी रिएक्शन हैपेंस. जो हमारा अटैकिंग सिस्टम होता है बहुत ज़्यादा एक्टिवेट होता है. दैट इज व्हेन आफ्टर day 5. सो day 5 तक यू बी वेरी कॉशियस कि आपको क्या मेडिसिन जा रहे हैं, आपका रिस्पॉन्स कैसे हो रहा है. day 5 to day 10 decides whether you'll end up in an ICU, whether you'll be home quarantined, or whether you'll need oxygen. And one more thing, talking about HRCTs, and a lot of people have this doubt, what is HRCT, when should we do HRCTs, when should we do RT-PCR, so and what is CRP levels. So ये क्या है? HRCT आपको सीवियरिटी बताता है. हर एक पर्सन को CT के थ्रू जाने की ज़रूरत नहीं है. इट्स एक्सपेंसिव, more than expensive. It's not needed to everyone. It has radiation in it. So not everyone needs to be exposed unless and until your doctor have told you to do so. एक person अगर mild symptoms है, उनको saturation is fine, need not do CT scan. Very clear. It's very clear unless and until if high risk patient ना हो वो. हाई रिस्क पेशेंट्स में कौन आते हैं? अगर कोई डायबिटिक हो, कोई हाइपरटेंशन हो, डायबिटीज़ कंट्रोल में नहीं है, बीपी कंट्रोल में नहीं है, कोई हार्ट डिसीज पेशेंट हो, सो दीज ऑल कम. कोई किडनी डिसऑर्डर का पेशेंट हो, ऑन पेशेंट ऑन कीमोथेरेपी. तो ये सारे जो लोग होते हैं, ये सब आते हैं योर हाई रिस्क पेशेंट्स. सो इनको CT स्कैन इम्पॉर्टेंट है अगर सिम्टम्स, अगर सैचुरेशन ड्रॉप हो रहा है तो. बट अदरवाइज नॉट एवरी पर्सन नीड अ CT स्कैन.
Also, there's a question that which test is more accurate, the antigen or RT-PCR?
No test is accurate, but RT-PCR ने बताया है, like, because nowadays it's showing negative results also. Like even if you're positive, it's showing negative. So there is no such test reliable कि ये this is better than this. But antigen जो टेस्ट होता है it's a rapid one, like आपको 5 minutes में आपका रिपोर्ट आ जाता है. So it is taken as a first guide to see whether you have COVID or not. But CT scan is the one which actually shows you कि कितना lung involvement है, कितने patches है, कितना viral pneumonia हुआ है या viral patches कितने हैं. So that is there. So there is a severity score on CT scan, which you can see if the person, so 25 तक होता है ये CT scan का scoring, and then if it's less than 8, मतलब the patient is mild category में आता है, तो 8 to 18, and then 18 के above it's severe category.
We'll all once more go through if any questions left from our viewers. And I would also like to tell our viewers that if you have any more questions, do write in the comment section. If not, then we'll end the session.
Yeah.
So we'll go through something like that if it's there.
I wanted to talk about the exercises which can be done at home.
Yes, ma'am. Yes.
Okay, it's a very important thing which you can do at home. So one thing is, first exercise you can do is, it's called the abdominal exercise, or what you have to do is close your everything, like keep your hand, you have to first be relaxed, and then you have to breathe in through your mouth and breathe out through your nose. So you do that. You breathe in through your nose, so exactly opposite. You breathe in through your nose and exhale through your mouth. And when you breathe in, जब आप सांस अंदर लेते हो तब आपका पेट फूलना चाहिए. So that you do it. तो जब अंदर लेते हो आपका पेट फूलना चाहिए, and when you release it from your mouth, आपका पेट flat होना चाहिए. So that is how you do it, and it really helps. It focuses on your oxygenation levels. The second exercise you can do, it's called the deep abdominal exercises, where you can keep your hand like this. Just कोई pressure नहीं देना आपको, hand आपको ऐसे रखना है, and then the same which you have done, कि breathe in breathe out, पर आपको थोड़ा सा tilt होके करना है. So you do this, breathe in and breathe out, and then you do this and breathe in and breathe out. ये हम usually pediatric बच्चों में करते हैं, जो babies, जो like kids जो होते हैं, उन लोग में हम ये करते हैं. It has really helped. The third thing you can do at home is spirometry. ये सबको लाने की जरूरत नहीं है, पर अगर हो तो good. So this is a spirometer. So इसमें 3 balls होते हैं. This is 1, 2 and 3. And ये attachment होता है ऐसा. So this opens out and then you can just insert this. और यहाँ से ये mouthpiece होता है. यहाँ से patient breathe, मतलब उसमें फूंकता है अंदर, and the balls ऊपर जाते हैं. जितने balls ऊपर जाते हैं, that means you're increasing your capacity. So ये 3 balls जाते हैं. This is 600, 900 and 1200. Accordingly you can breathe in. अगर ये आप नहीं ले पाए हो तो simple एक balloon ले सकते हो, and you can balloons फुला सकते हो. So that is one of the good exercise for your lung. So if patient has COVID, has recovered from COVID, hospital से discharge हुआ है, they can do this. Also they can do proning. So proning has shown a beneficial thing. What is proning is, आपको आपके chest पे सोना है, उल्टा सोना है for at least 2 hours. तो जब आप उल्टा सोते हैं, जब आप सीधा सोते हो ना, तो सारा fluid collection पीछे हो जाता है in COVID patients or whatever it is. और जब आप उल्टा सोते हो तो जो fluid collection सब evenly distribute होके oxygenation improve हो जाता है. तो इसीलिए आजकल हॉस्पिटल्स में भी, even if the patient has mask on, हम लोग उल्टा सुला रहे हैं patients को. So it's really helping. You can do that. You can ask any of your friends to do that. That's also on my Instagram page about proning, how to prone और क्या करना है. So you can do that. That will really help because that is in your hand. You can do it at your home, or you can tell your friends around कि मम्मी को ऐसे सुला दे, या फिर तेरे friends को बोल सकते हो कि ऐसा कर लो. So it's proving good, beneficial.
Actually, we had no idea about this. Thank you for telling this. I mean, the proning one, which we'll also share with others too.
Yeah, please do share.
किसी ने, मतलब मैंने भी आज तक नहीं देखा. It was really good to know कि मतलब किसी को जल्दी कोई अगर है तो उनको बता सकते हैं, right? कि you can do like this.
अगर आपको ऑक्सीजन नहीं हो, आपका ऑक्सीजन लेवल ड्रॉप हो रहा है जल्दी, मतलब ऑक्सीजन ड्रॉप हो रहा है, टिल देन द टेम्पररी टाइम वी हैव, व्हाट यू कैन डू इज आस्क द पेशेंट टू स्लीप उल्टा. तब तक यू कैन कॉल अप द एम्बुलेंस, और यू कैन कॉल अप द हॉस्पिटल जो पीपल है. टिल देन द आस्क द पेशेंट टू स्लीप सुपाइन, उल्टा ही सोना है उनको, एंड दैट इज हाउ वी कैन इम्प्रूव द ऑक्सीजनेशन.
Thank you so much for telling all that. I mean, वो exercises would all, मतलब we are also planning to give a key takeaways for our viewers. So अगर someone will like to tell our viewers कि अगर वो कुछ miss कर रहे हैं, तो we would give you all the resources. जो exercises डॉक्टर ने बताया है, we will give that to you like soon. So ma'am, also there's some questions like if a person has pneumonia during COVID, will they die? Like it's a serious question, but
No, not compulsory. If it is pneumonia, तो death होना ही है. It is not the scenario because if with proper treatment, if it's given IV, अगर IV intravenous drug शुरू होंगे या फिर oxygenation अच्छा है तो they can improve. That's what I was telling about my grandmother. She was really serious and now she is at home. So it's a miracle. She's 80-year-old with diabetes and she had a history of stroke also. So it's not like that कि कुछ को निमोनिया मरने ही वाला है तो take that out of your mind. ऐसा कुछ नहीं होता. People have recovered from really getting on ventilators and off the ventilators, so they have survived. I have seen myself, and this is ऐसा कोई नहीं है कि patient मरने ही वाला है.
our viewers are very curious to know, like we have got a lot of questions.
Yeah.
We hope we are not taking too much of your time.
No. You ask whatever is helping. I can do it. You can ask me questions, whatever they're asking.
Yeah. What are the risks of reinfection and what causes a virus to change to a new variant?
Chances of reinfection are pretty high. ऐसा अगर कोई बोल रहा हो कि मुझे एक बार हुआ है तो फिर से नहीं होने वाला, so they are living in some other world. ऐसा कुछ नहीं है. जिसको हुआ है उसको डबल हुआ है, उसको 3 times भी हुआ है. So reinfection के chances, if you don't take the precautions again, you're going to get infected in spite of having vaccination and in spite of taking all the precautions. And the second question was what? Regarding the mutations.
Yeah, like what causes a virus to change to a new variant?
It's just that when you give certain amount of medications to a person and if that virus is inside, it tries to change, like adapt होना कोई चीज को. So whenever even you are thrown into some, अगर आपको कोई hut में छोड़ दिया या फिर कहाँ भी छोड़ दिया, तो you try to change according to the and combat that situation. The same thing happens with the virus also. So to overcome that antibiotics or antivirals, whatever you're giving, even it's COVID or bacterial infection, anything, it tries to change its form to survive in that environment. So that is how they change accordingly. Because सबको survival of the fittest जो बोलते हैं हम, तो वो तो चलता ही रहता है. So that is how even it comes with the virus also or any other organism. They just want to survive in your body or anywhere outside. So they try to change their pattern. And this mutation is going to happen. It's just going to happen. All mutations आने वाले हैं, and they are still there actually out.
Yeah, this is a very important question. That what would you suggest for the stress that people go through during COVID? Like we are actually neglecting the main part that people are going through, which is stress, depression, anxiety. So, will you help us in that?
Yeah. So, these days, I completely understand कि कितना problem हो रहा है. People are going in depression and so many people complaining नहीं हो पा रहा है उनसे cope up because they have lost their loved ones or उनके family में कुछ हो रहा हो. So what they can do is meditation is obviously पहले start सदियों से आ रहा है कि you can meditate or you can just focus on your breathing. You breathe in and breathe out. That you can do. You can listen to music or else you can just talk to your friends and family. I think that is going to help you a lot because we as doctors are also going through such a bad phase. We treat one patient and the other patient collapses. So that is how it's happening, and it's very difficult for us as well as doctors ki how to cope up with this because we are short on resources. We have a lot of workload. We have our everything we have, and even seeing person collapsing there and the relatives asking us help कि मेरे बच्चे को बचाओ. So it's a very bad time. So what you can do is just get involved somewhere. Don't sit alone and crib or cry about it because it's going to remain for a while abhi. So just accept the fact. So acceptance is very important. If you stay in denial, it's not going to help. Then just accept it कि ये है अभी हमको इसको We have to find solution to it. We have to help as many as people around us. We should know what is happening to them, and we should just try to talk it out and just stay with that person if possible in this either a video call. You don't have to go and personally meet them, but a video call would help, or any book reading, whatever we do. So that you can do.
Ma'am, there's a question of how could cancer patient fight this?
The same as other people fight it, the same way. There is no this thing ki cancer, obviously it's an immunocompromised state, or working in a cancer institute, I know ki patients have survived and combat everything, and मतलब वो बच गए हैं, और they are still in a good shape अभी भी. तो it goes the same way. उनको भी medications वही चलेंगी, उनको भी सारा वही चलेगा, और ऐसे नहीं है कि अगर कैंसर हो तो they are not going to make it, ऐसा कुछ भी नहीं है. So they are also going to make it, and the treatment remains same for everyone, mild, moderate, severe, and accordingly we treat the patients.
Ma'am, there's a question, what is Jal Neti? Does it help?
What is?
I'll spell it out. What is Jal Neti? JALNETI.
No, I'm not aware about this. Is it some Ayurveda thing? I think if some doctor is on chats and aware about this, they can throw some light on it and even let us know what is it. I think it's some Ayurvedic thing, which is they are giving the roots of something. I feel I've read about it, but I can't comment because I don't have much knowledge about that.
Yeah, no problem.
Is it?
So there's a question. It is said that pronal breathing helps to increase the oxygen levels, but I have heard somewhere that it affects heart at the same time. What are your views on that?
Okay, so heart affection किसको होता है? Who had heart disease? अगर कोई patient हो जो already जिसको heart attack आया हो, recently they have हार्ट अटैक आया हो, या फिर बिकॉज ऑफ एनी रीजन उनको कोई पल्मोनरी एडेमा हो, या फिर लाइक चेस्ट में पानी, मतलब द हार्ट हैज बीन अफेक्टेड, या फिर स्टेंट हुआ हो, या कोरोनरी बाईपास हुआ हो, इन सच पेशेंट्स इट इज एडवाइज नॉट टू डू सो. इट इज बिकॉज व्हेन यू स्लीप, जब आप उल्टा सोते हो, इट क्रिएट्स अ प्रेशर ऑन योर हार्ट. बट इट इज फॉर नॉर्मल पीपल इट इज नॉट गोइंग टू अफेक्ट, बिकॉज योर बॉडी विल, मतलब आपकी बॉडी उसको फाइट कर सकती है. दैट इज नॉट एन इशू. बट इन सच पेशेंट्स लाइक कोरोनरी बाईपास पेशेंट और हार्ट अटैक रिसेंटली हुआ है, इट्स बेटर दे डोंट डू इट. बट दिस इज जस्ट द एक्सट्रीम सिचुएशन आई वाज सेइंग, लाइक यू आर आउट ऑफ ऑक्सीजन एंड कुछ हेल्प नहीं मिल रहा हो. सो वी हैव टू वे द रिस्क वर्सेस बेनिफिट रेशियो एंड डू इट अकॉर्डिंगली. अगर मेरी जान बच रही हो तो व्हाई नॉट डू इट. एंड नॉर्मल पीपल तो कैन ऑब्वियसली डू इट. घर पे जो सो रहे हो तो सब उल्टा ही सोना है, 2 घंटा साइड्स पे सोना है, यही करना है.
We would wind up with this last question. If person having heart problem, then he or she should consult doctor vaccine लेने से पहले.
It's advisable कि आप, मतलब it's said कि आप डॉक्टर से बात करिए कि मुझे कब लेना चाहिए, क्योंकि अगेन कब उन्होंने मेडिसिन स्टॉप करनी चाहिए कि नहीं चाहिए, उनके कौन से मेडिकेशन चालू है. इट्स बेटर टू कंसल्ट योर फैमिली फिजिशियन हु इज देयर अबाउट योर ड्रग हिस्ट्री एंड एवरीथिंग. It would be better if you do that, or else there is no contraindication, like there is no just thing कि heart patients में नहीं लेना है, ऐसा कुछ नहीं है. They are at high risk. They should be the first to get vaccinated.
There's one more, like, so COVID is not spreading through air.
No, it is not. So it is spreading through a droplet infection. ऐसे नहीं कि air में है and it's spreading. ऐसा होता था तो every other person would have been hospitalized till now. ऐसे नहीं है. It's a droplet infection and it is not in the air. That's what I would say.
I think you've already answered this, but if a person is on COVID kit, when to take the vaccine then?
COVID kit, as in if he's taking medications?
It's something, Zivardo kit.
Zivardo kit. Is it about the person is asking again? Can you ask him? Is it about medication or something?
Snehal Jaiswal, can you answer this? Like, so we can say something about that.
Zivado kit. Okay. So it is a combination of ivermectin and hydrochloroquine. That is okay. HCQs. No, you shouldn't be taking vaccine if you're taking that drug, because obviously that means you're infected, and that's why you're taking the medications. So complete your course, complete your 10 days of isolation, 14 days of isolation, and then you can think about getting vaccinated.
Okay, so that was it, and we have got some good comments, very informative. And I would on behalf of the whole Aashna Cares, I would like to thank you for giving your precious time. It was such an amazing time. Actually, most of the things I didn't knew anything about it. It was all new for me, and I would really like to thank you and also our viewers who were throughout with us and gave us some good questions like to put a light on. And also, I would also tell them that Ashna Care volunteers are working round the clock to connect the resources. So if you need any help, you can reach out to us. You can see, you can follow us on our on our social media platforms. It's present. I'll say someone to put it in the chat box itself, and also it is in the description box. So, if you have anything, you can tell us. We are trying our best to do that, and I would really like to thank you for giving your time. And it was such an amazing session. And for our viewers, do like, share, and subscribe. And it was an amazing time. Yes, doctor.
Yeah, thank you, Rajeshwari. I hope Ashna Cares get lot of support from everyone around, because they are doing a very great job. They are doing, like, they're not expecting anything out of it. They're just doing it for the sake of people, and I think that's incredible. And hats off to your team for taking such efforts, keeping up the good work of arranging everything and calling me for this session. Even I learned in the process. I read about it. I went to a lot of articles, and I am I myself is now aware about things which I didn't know about. Like earlier, मुझे नहीं पता था कि ये सारा है. Thank you for that. And viewers, they had put a great questions, like बहुत अच्छे questions थे. It was not illogical questions. I felt that was really relevant. And I hope everyone, we all are going through difficult times, and we are going to cope up with this. Everyone around us, we are going to make it happen, like in a good way. Like, just go ahead, just go with the flow, help others around, be there for everyone.
Thank you, doctor.
Yeah, thank you. Have a great day.
Thank you.
Goodbye.
Goodbye.